Good
Hello.
afternoon.
Good afternoon. How are you?
Good. How are you?
Oh, good.
Good, good. Yay. Hi, Matt. Hi, Jade. Thanks for joining me.
No problem.
Okay, so I'm gonna get both of you to do a little bit of an introduction, like a minute of just to explain who you are, where you are, what you do, if that is okay for everybody. But this is our vegan doctors talk about anything plant-based vegan that people might have questions for regarding nutrition. So go ahead.
Who first?
I will start. All right. So I'm Dr. Jade Dittaro. I am a family medicine trained physician. I live in Kelowna, BC, and I became interested a few years ago in lifestyle medicine, particularly nutrition and prevention. And I work as a consultant in lifestyle medicine now through a clinic in Victoria called Aroga Lifestyle Medicine. Really passionate about it, challenging my American Boards of Lifestyle Medicine exam this fall. And I do a lot of what I do because I'm a director of a animal sanctuary. I believe in helping the animals, the planet. I'm a huge proponent of human health, and I have a 3-year-old. And so I just want to see the world a better place for her.
Okay, and I am Dr. Matthew Nagra. I'm a naturopathic doctor here in Vancouver, BC. I practice out of Tanumi Integrated Health on Commercial Drive. I've personally been 100% plant-based vegan for almost 10 years now. That'll be coming up in the new year. And I use lifestyle medicine just like Jade or diet and lifestyle intervention in my practice on a daily basis. It's my first go-to therapy for anybody dealing with chronic illness. And I also volunteer for the nonprofit nutritionfacts.org, which is a great free resource for people looking for evidence-based nutrition information. And lastly, I volunteer at Happy Herd as well, which is a farm sanctuary out in Aldergrove, BC. And that's actually the photo you used was me with one of the dairy rescues, Scooter, at the farm.
Perfect. Thank you so much. Thank you for that. And I'm just going to do kind of like a fun one question before we get started. So Matt, let's start with you. What is your favorite vegan dish?
Favorite vegan dish.
Off the cuff. What's your favorite?
Okay. I feel like it's not really a dish, but my favorite food is actually very simple. It's just mangoes.
Okay.
Above everything else, I was just eating dried mangoes to be
I was
completely.
going to ask you if it's dried mangoes or if it's like fresh.
The fresh, but right now this time of year you can't really get the fresh stuff. So yeah, go with the dried. But then as far as other dishes, like my whole life, I'd say spaghetti was up there as right up top, near the top of my favorites. So that's probably it.
Okay, perfect. And you, Jade, any favorites?
Well, I can't really say nutritional yeast is necessarily a food.
Popcorn,
But
it's so good.
I know. The way I operate is I will build a bowl solely around having some semblance of nutritional yeast in it, whether it's like in the sauce or sprinkled on top. So I'm just the queen of throwing it together. But what I really, really love is like a deconstructed sushi bowl, and I'll do the marinated carrots and the seaweed in it, and like that. I could eat that every day, all day.
Oh, avocado rolls. Yeah, no, that's my go-to as well. So good. Awesome. Well, thank you so much. Okay, so our first question, and I wonder if this is more of a Jade question, so I know that you both have discussed some of this, is going off of breastfeeding or formula. What is the best milk in a, say, plant-based milk, and why?
Okay, so we both definitely can touch on this, and
Perfect.
we've both talked about it in different presentations, but I live through experience, right? Because when you have a child, you worry obsessively, like, am I making the right decision? But the go-to is an organic unsweetened soy milk. So that has a bit more of the fat content. It has the extra nutrients, especially the ones that are fortified. It's absolutely safe. We could go on a whole tangent about how soy is totally safe. All of the rumors are false. There is nothing wrong with having soy. In fact, it can be beneficial. And water, right? Those are the drinks of choice. So I'll let Matt elaborate, just because I know he's really passionate about this too.
Yeah. So I absolutely agree with the unsweetened soy milk for sure is the way to go. But so the American Academy of Pediatrics actually put out a joint statement with some other pediatric organizations this past year, and they actually said that soy milk is the only plant milk they suggest for children after age 1. Of course, in that first year, breast milk is best. If needed, soy formula can be used, but after 1 year, they say soy milk is a suitable alternative. And then for Canada, it's a little bit different. The Canadian Pediatric Society says after age 2 to introduce it, because they recommend breastfeeding continually, until you're done the 2 years as well. But either way, both of them say soy milk is absolutely safe. It's a good alternative, and it is the most nutritious of all the plant milks as well.
Mm-hmm.
So is it mainly because of the fats then, or why not oat milk? Because I know oat milk's kind of getting a lot of craze nowadays.
It's partially that, but so the macronutrients are closest to breast milk in soy milk. Actually, oat milk is pretty good, but it doesn't have the same micronutrient content, so not the same amount of like the vitamins and minerals that a child will need. So that's why they suggest the soy milk instead.
Okay, even after fortification that they usually do?
Soy milk's still superior.
Okay, great.
And can I add one thing? Because Matt made a really good point, and it kind of slipped by, was about breastfeeding. A lot of parents have this misconception that breastfeeding just kind of stops at a year, because that's what we all think of and know. But keep going. Like the World Health Organization says to age 2, and we have the ability to digest lactose, inherently in us up until age 4. And then, I mean, obviously we've created this ability to digest it beyond, but like, don't be shy. You can keep going with breastfeeding.
Perfect, thank you. And so just to touch base on the fact that I know, Jade, you mentioned is that fear that people do have attached to soy, especially I'm guessing, if you can expand, both of you, on the estrogen part, please.
I'll take that one first. So soy contains phytoestrogens. They look like estrogen molecules. You look at them, the structure and everything. They're similar, so they bind to some of the same receptors, but they're 1/1000th the strength of our own estrogen. So obviously they don't have the same kind of impact. On top of that, they prefer to bind to certain receptors in our body known as beta receptors. And so these receptors, when they bind, they have different effects than normal estrogen would have. So in breast tissue, they can have anti-estrogenic effects. They can actually block the estrogen response. In bone tissue, they can have a pro-estrogenic effect, which is good for having strong bones, right? That's why women after post-menopause, they end up with osteoporosis at a higher rate. And that's because of or at least in part because of the lack of estrogen activity that they're getting. So soy consumption, go figure, reduces risk of osteoporosis. Because of the anti-estrogenic effects in breast tissue, reduces the risk of breast cancer. In fact, women who are predisposed to breast cancer, so they have BRCA1 or BRCA2 gene mutations, so there are these mutations that put someone at a higher risk, they're inherited, they actually have a reduced risk if they consume more soy as well. And then women who are currently battling breast cancer or have previously battled breast cancer have higher survival rates if they consume more soy. So no matter who you're talking about, it's going to be beneficial. And then that's without getting into like ovarian cancer, endometrial cancer, for men, prostate cancer, reduces risk of all of those on top of cardiovascular disease, type 2 diabetes, and so on. There is really no risk there. It's totally founded on research on like rats and that sort of thing. But fortunately, we aren't rats. So the human data absolutely shows that is beneficial.
Now, Matt, how much do adult humans actually have to consume before they could potentially have a detrimental? Isn't it like something like 6 liters of soy milk a day before there was any estrogenic?
So we don't know for sure. Like we've done trials on like daily consumption at multiple servings, and that's fine. But there are 2 case studies of men who consume 12 to 20 servings a day, and they were having like a full gallon, like 4 liters of soy milk and other products on top of that. But even in those case studies, because there's only 2 people, we still don't know for sure. Like we can't say for sure that it was the soy that did it. But if the soy did, we know that it only happens in just absolutely ridiculous types of consumption. 3 servings a day, 5 servings a day, whatever, no issue. And that's already a lot right there.
And so, to counter that, so people are worried about hormones.
Yeah.
So you're absolutely right. Like soy is fantastic. There's nothing to worry about. And I always tell my patients, like, listen, if you're worried about hormones, I want you to think about this. When they milk a cow, oftentimes, because production is money, that cow is often pregnant again. And so think of a pregnant mammal, they have a really high amount of circulating hormones. And so even though it's still relatively low amounts that's getting into the milk, it's still getting into the milk. And so if people are really being conscientious about avoiding foods that have a ton of hormone in it, then I would always argue, well, why have dairy then? Because that's what happens. It is a pregnant cow who they are getting the milk from, and especially as the pregnancy goes further on. So that's the other piece to talking about hormones
Yeah,
always.
for sure. Agreed.
Agreed. Yeah, and I was gonna say, like, the 4 gallons of soy milk, I don't know anybody who drinks that much. Like,
No.
would a bodybuilder do that? Like, why would somebody do that? Were they bodybuilders?
Well, there are bodybuilders that are doing like a gallon of milk a day now. So you just swap that out for soy milk. It's ridiculous. It's obviously not healthy, but I
Yeah.
find it really funny. I had somebody, I was in kind of a debate with them talking about how they want to have a gallon of milk a day, but they've heard that having that much soy milk is bad. I'm like, do you think having that much dairy milk is good for you? Like, it's such a weird double standard that they're holding. Like, nobody is doing that for health. So it's just, yeah, totally ridiculous.
Yeah. No, awesome. Okay, so for our next question, how can I ensure that my child is getting all the nutrients he/she needs on a plant-based vegan diet? Who would like to take that first? That's a big one.
Yeah.
I'll give like a little intro and then I'll let Matt dive into it because it's funny, I think very valid question. I always appreciate when parents are concerned about their child's nutrition. I love to put a side by side of like what kids eat on a whole food plant-based diet, which is, usually a lot of rainbow, a lot of good whole grains and whatnot. You're getting beans and lentils, legumes. And then I want to juxtapose it against what the average standard American diet is for kids, sugary breakfast cereal with milk for breakfast. Maybe they'll have some grapes, bologna sandwich, McDonald's. And then I go, okay, which one are we worried about the nutrients in? So that's just setting the stage that like, yeah, there's a couple key things that you have to worry about, but overall, even when you look at the micronutrients, you're already ahead just by switching to being more plant predominant. So we could break it down further. I don't know, Matt, how do you want to even start?
Yeah, like so for starters, I mean, you kind of made the comparison to the general public. Well, we can go beyond that. We have data on Seventh-day Adventist populations. So these are populations of people that are very healthy. And they've done actually nutrient comparisons between those who are either strictly or almost strictly plant-based versus those who still eat some meat. And again, these are people eating way healthier than the general population. But even in those populations, we see that the vegans and vegetarians, totally healthy, totally fine, getting a lot of what they need. Of course, eating similar to even our new Canada food guide. You got your whole grains, your legumes, your fruits and vegetables. As long as you're doing that and you're diversifying your diet, I don't think it's something we really need to worry about. One thing I am a little more concerned with children, though, is making sure they're getting in the calories. And that's because plant foods are generally very low in calories. So you can't just have them eating fruits and vegetables. You need to make sure they're having decent servings of your whole grains, your legumes, and honestly, maybe including a little bit of olive oil in some of their meals, or
Avocado.
Yeah, exactly. Avocado oil is a good one. Even if you wanted to throw some flax oil or walnut oil in a smoothie, it's not a bad idea, just to make sure they get the calories that they need. But if they're eating an overall diverse whole food plant-based diet, it's not a big concern. Of course, there are a couple supplements we might want to consider, which I think we're going to get to in a little bit anyway. So we can touch on those in more detail. But compared to the general population, they're usually far, far better off as far as nutrition goes.
Yeah. And really with parents, a lot of what we need to understand is that just because a kiddo tries something once, it doesn't mean they don't like it. Diversity is key. Like we have learned over and over now that the gut microbiome flourishes, and so do we from a micronutrient, phytonutrient perspective, the different types we have. So say your kid doesn't like broccoli one day, well, try it again tomorrow, put it in something different, cook it a different way. And so, yes, different variety of plant like fruits and vegetables, trying all sorts of different nuts and seeds, ton of different whole grains. And listen, like you don't have to stick to just oatmeal for breakfast. You can have millet, you can have barley, you can have quinoa. We make breakfast brown rice sometimes. It's like what's in the fridge, add some soy milk, mash up a banana, throw in some flaxseed, a little maple syrup, look at some cinnamon, there you go. So that's how you can kind of diversify it up. And that gives you stuff like iron, and you can get enough calcium. So, um, Serene, do you think we should break it down a little bit in terms of some of the key nutrients?
Yeah,
Yeah, I think
if you want, because the next one was gonna be there is a question regards to if there is any need for supplements. So you can kind of go into, we can just kind of lead into that right now.
well, let's hit on a couple of the key nutrients because you brought one up, Jade, the iron.
Yeah.
So children or infants, when they're born, they have iron from their mother, but breast milk is not a good source. So they have a store, they have certain amounts of iron in their body that eventually run out, usually at the 4 to 6 month range. And guess what? That's usually when we introduce solid foods. So when we're introducing solid foods, it's going to be really important to make sure we're getting iron-rich foods. These are going to be things like a lot of infant cereals are actually fortified. So if you can get a nice, pretty healthy infant fortified cereal, that's going to be good. Your legumes are going to be great sources, making sure they're getting some of those dark greens in, like kale, for example, is going to be a good source, and mixing it up with vitamin C rich foods to help with absorption, like squeezing some lemon on there, having some oranges. It's just making sure that we're getting those iron rich foods. Other than that, calcium might be a concern, but especially if you're bringing them up on like plant milks, like we mentioned, and you're again making sure they're getting their greens and legumes and everything, is not really going to be an issue either. I would say it's more if you're really not focused at all on trying to diversify their diet, like we mentioned earlier, then yeah, you can run into problems. But if you're doing a good job at that, it shouldn't be a huge issue.
And then that, calcium, we always think of vitamin D with it. So yes, vitamin D supplementation is important. You're taught that when your child is breastfeeding or not, but that's something you just continue. It's the same for adults, right? So, you can get lovely little vitamin D drops, and it just put a couple, whether they'll let you on their tongue, on a spoon, whatever, in their oatmeal, but that's an easy one to hit up.
Yeah.
Especially because we live in the more shady parts of the world.
Yeah,
It's kind of
Northern
recommended
Hemisphere.
anyways, right?
Yeah, and you make those kind of things fun, right? It's like, hey, mom has hers, babe has theirs, high five, cheers. Yeah. So that's iron, calcium, vitamin D. Now let's talk about protein, because that's the big thing, right? Everybody goes, what about protein? Listen, from at least from an adult perspective, we all get too much. So zero 0.8 grams per kilogram of lean body mass is what's recommended for the average person. A little bit more if you're an athlete. A lot of people get like 2, 3 times what they actually need, and it can be detrimental. So with your child, if you're making sure that they try different beans and legumes, there's protein there. But guess what? Vegetables have protein. So as long as your kid's getting a little bit of veggies in, and if they don't like veggies, that's what things like smoothies are for, until you can keep trying to get it introduced. And Matt, I'm going to steal this from you and give him all the credit. So Matt tells people to keep track. If you're not sure, you go on Chronometer, right, Matt? You can plug in
I
the
mean,
age.
yeah.
You can, though. It, like, a lot of people, that's how they feel good. They're reassured. They do a couple days of tracking. Is my kid meeting their needs?
Yeah, and I think they have settings on there for specific ages too. I might be
They
wrong
do.
about that.
No,
Yeah.
they do, because I've checked for my own daughter. So
Yeah,
yeah.
it's like protein. You mentioned we get more than we need. Well, vegans actually get more per body weight than meat eaters do on average. So we're getting even more than we need.
But
Um,
it's good sources of protein.
yeah, and actually, so it's funny. Research on like protein intake and actually mortality risk, so like long-term risk of death and disease, actually shows that higher protein intakes actually do usually lead to better outcomes only when the protein comes from plants. When you swap out a plant protein for animal protein, the risk actually goes up for animal protein. So again, it depends on the type of protein you're choosing as well. I do think we should touch on B12 though, if we haven't done that
Yes,
yet.
absolutely.
So for infants, if they're breastfeeding regularly or exclusively, then they should be getting B12 through their mother who is supplementing, right? So it's important for the mother to supplement in that case. After they start to wean off, after say like a year, and I'm taking this straight from the Plant Nutrition Project Pediatric Quick Start Guide, from 1 to 15 years, a 500 microgram supplement per week is all that's really needed. So that's a pretty small dose. And then after that, it kind of depends on the type of B12 you're supplementing and everything. So it's hard to give firm doses, but if they're doing cyanocobalamin, which is the cheapest form, then usually about 250 micrograms a day, or just 2,500 once a week, as recommended by nutritionfacts.org, actually. So there's all sorts of different dosing regimes you can do. It's overall a very safe supplement. I'm not too worried with somebody taking a little too much of it, but it is important once they stop breastfeeding to make sure they're on a B12 as well.
Yeah, that's so true. And even though I'm like, yeah, nutritional yeast, like I should have merchandise, don't rely on B12 fortified nutritional yeast as a supplement. So a lot of people ask that question, and it is safer and better to get a good plant-based B12 supplement, like actually the form. And listen, again, from a practicality standpoint, even toddlers can get tiny little pills. You can just snap it in half and they can chew it and swallow it down. It's not a big deal.
Yeah, or you can even do drops. Like
You
they
can.
have liquid ones. You throw it in their smoothie or something. They won't even know.
Easy. Yeah.
So you would recommend rather that than relying on things like, because most of the plant-based milks nowadays, and even like the meat substitutes or whatever you want to call them, are fortified with B12. So you would still recommend rather to.
I would 100%, just because with those. So actually, Dr. Michael Greger from Nutrition Facts did a really good series on this. I don't think it's out yet. So that might be my volunteer privilege coming in, the fact that I've seen it already.
Like,
But
oops.
it's so he's got a video series coming out, and he talks about say using nutritional yeast, and you would have to have, for an adult, and of course it'd be less for kids, but for an adult, to make sure, because you don't absorb all of it, you actually absorb a very small percentage, you would have to have basically a full tablespoon of highly fortified nutritional yeast 3 times a day, every day.
Yeah,
And not at once. They have to be separated too, because of the percent you absorb. I just think it's way too much work and planning and everything to make sure you're hitting all those targets.
Oh yeah, no, but what about, like, let's say plant-based milks? Like most of them, like if you have like a cup, which most kids have, it's like 50% of your daily intake. Is there any studies on how much that actually absorbs?
It is the same as the primary supplement form, as cyanocobalamin is what they use because it's the cheapest. And so it'll be the same absorption, I would guess, as to what that is. So you wouldn't absorb all of that for sure.
Yeah. And so the thing too is like, okay, so, say your kiddo is recommended to have a B12 supplement like 3 days a week, and you miss 1 or 2 days, but they have a lot of soy milk in their diet and whatnot. Well, then, you don't have to obsess as much, but I'm not going to make that a formal recommendation. Like as a physician, I think I've seen enough, B12 deficiency in the general population and even in kids that if that is one nutrient I can't emphasize the importance of enough. Like you need B12.
Okay, so that's in the general public, not just vegans, correct?
Oh yeah.
Yeah. The general public, like a lot of it comes down to like over the age of 50, people don't absorb it as well. We know enough about the gut microbiome now and about dysbiosis that people who have generally fairly unhealthy diets and their gut microbiome's disrupted or by pesticides and toxins, they don't absorb as much. So you have to be mindful of B12. So that's like this is a blanket statement for all.
Yeah.
Okay.
Yeah, and then after age 65, they recommend injections a lot of the time because it totally bypasses the gut altogether, so you don't even have to worry about absorption.
Mm-hmm.
Okay. And just for people who are like, oh, vegans, all you do is take supplements, do you have any comebacks?
I take vitamin B12 and vitamin D, and once in a while, I'll take an algae-based DHA supplement. I would say most of the health-conscious meat eaters I know take like 2 or 3 times as much as I do.
Yeah.
Yeah, and I am the exact same way. That's exactly what I do. And my 3-year-old takes B12 and vitamin D. That's it.
I was waiting for Matt to go into how industry actually supplements.
Oh yeah, let's talk about that one. Yeah,
Oh,
on
boy.
the topic of B12, so 55% of all the B12 that's produced in the world gets sold to livestock. It's actually fed to the animals that people are eating, and that's because if they aren't grazing, if they aren't consuming, food from healthy soils that contain cobalt, they can't make B12, or the bacteria in their guts can't make B12. So they're actually supplemented. So most people who are eating meat, because 96 or 99% of it, depending on what type of meat you're talking about, gets produced in factory farms, they're taking a supplement, just they don't know it. So that's also a really weird argument I hear a lot.
Yeah, you're just cutting out the like
yeah
800-pound middleman by not
exactly.
eating the cow.
Exactly.
Yeah, and all the environmental destruction and water waste and
Yeah.
everything like that that
And
comes with
taking
it
a
too.
supplement directly, the type that's in the supplements, you absorb more of it than you do from meat, especially if your stomach acid production is low, or like Jade was talking about with gut issues. So that's just a win-win, really. There's you. I mean, you can, if you look online, you can get a year supply of B12 cyanocobalamin for like a couple dollars. It's really cheap. So
Mhm.
no reason not to.
Yeah, so we're pretty much here to say to people, like, do not shy away from a whole food plant-based diet for your family because you're worried that you aren't going to get enough of your nutrients and feel like you need to supplement. It's not true. Otherwise, my daughter would be in the hospital right now. We are thriving. We're all doing great. Anybody I see is doing great. It's just, it's if anything, eating this way, like I said earlier, makes you more health conscious and a little more aware. Um, but you should be that way all the time anyway. If the general population was this health conscious, we'd all be that much better for it.
Yeah, and while we're telling people that vegans don't need to take all the supplements, let's talk about one more supplement. That's the omega-3s that
Yeah,
like
yeah.
the long chain omega-3s that you get from, a lot of people get from fish. If you don't know, fish actually don't make these omega-3s. They get them from algae, or microalgae rather, or they consume smaller fish and sea creatures that consume microalgae. So it's actually made in the algae. And now we have companies that just grow the algae in clean tanks away from all the pollution in the oceans, and produce these supplements for us where you can have a really clean, pollutant-free source of these omega-3s. Now, I'm actually very mixed on whether it's absolutely necessary for the general population or even the plant-based population if you're eating a lot of omega-3 rich foods like flax, chia, and walnuts, because we convert those omega-3s into these long chains. There's just debate around how much we do. So what the science says as a whole is that for people with heart disease, with cardiovascular disease, when, again, we're not talking about kids here usually, but older adults, they should absolutely supplement. It decreases the risk of having a further heart attack. For people with cognitive impairment, so people with memory issues, or brain fog, those types of things, they may also benefit. But for the rest of the people, it's really not looking great for whether or not we need to supplement it. I don't see a huge reason for it. It's one of those things that we can do as an extra precautionary measure if we want. Where I do think it's really important, though, is in children. And that's because they have a developing brain. Those omega-3 fats do make up a decent portion of their brain weight. And right now, we just don't have enough research showing, what healthy plant-based eaters end up with if they don't consume those omega-3s. So until we have more data, I think it's a good idea to make sure the mother, prior to pregnancy even, and throughout pregnancy supplements, and then after weaning them off breast milk, getting them on a supplement as well through the first early stages of life there.
Awesome. Well, thank you. Our next question is, what is the benefit to my child for eating plant-based vegan?
Oh, brace yourselves. Where do we begin? The benefits are endless. I'm going to let Matt hit a really important point related to cardiovascular disease, but you know, not only are you introducing them to a diversity of plants, which helps flourish their gut microbiome, which we're finding is to be almost the center of disease in the body. More and more research is coming out saying, like, dysbiosis, this disruption in these organisms in our gut is leading to inflammation, long-term implications. But so you're starting them off on that healthy path. But when you look at what you actually eat on a whole food plant-based diet, and the diversity that happens is like getting them started young and getting them liking a variety of healthy foods young sets them up for success, right? Normal healthy weight, less chance of obesity as they get older, but also creating those healthy habits as they're starting young, right? When your kids' favorite foods are broccoli and tofu and seaweed, and those are sustainable things that are going to last forever. Now on to Matt's excellent point.
I'll add to that first. Also, we have tons of research on influencing taste preferences. So what the mother eats during pregnancy influences the taste preferences of the child once they're born. Again, what the mother is eating during breastfeeding influences taste preferences. And then early in life, those taste preferences are carried on through the rest of their lives. So it's good, and it's really important to instill these healthy behaviors at a young age. Now, onto cardiovascular disease. Of course, heart disease is one of those things that often gets written off as you know, an older person's disease. It's not something that affects kids. It's not something we need to worry about. Well, and that's something I got a lot as a kid too. I know my parents and uncles, aunts, they, you know, he's just a kid, let him have a burger or whatever. And I did. I ate all the burgers. But looking at data on children who had, you know, unfortunately passed away due to accidental causes, on autopsy, almost all children by age 10 have what are called fatty streaks already in their arteries. These are the early stages of heart disease. This is what will eventually actually develop into those plaques that everyone hears about that are in the arteries and cause heart disease. Well, I mean, those are just the early stages, but we also have data on soldiers that were killed in action in Korea. And we found that with an average age of 22, so they're 22 years on average, 75%, or I think it was 77% exactly, had not just those early stages, but actual atherosclerosis, actual plaque buildup in their arteries, and in some cases quite severe. So this is 22 years old. They've already got heart disease. It's just going to take another, you know, couple decades before it results in a heart attack. So it's really important to prevent that in the first place. Treating it is the hard part, but preventing it is super easy if we're eating, you know, overall very healthy plant-based diet. On top of, you know, other issues like diabetes and obesity. In fact, on that same note of you know, let them live, they're just kids. Well, if we instill these unhealthy behaviors at a young age, and we see our obesity epidemic going up through the roof, well, we have a meta-analysis from just 4 years ago. This is where they combine all the data on a subject. Over 200,000 individuals. They found that 55% of obese children go on to be obese in adolescence. 80% of obese adolescents remain obese into young adulthood, and 70% remain obese over age 30. So it's not something that can just be undone later in life. And that's where the big fallacy is, or that's where the big issue is that a lot of people are promoting. When, I mean, it's fine to have treats here and there. It's absolutely, and if they eventually choose to go that route, that's great. But I often hear parents criticize, you know, vegan parents for, you know, raising their kids a certain way and not giving them a choice. Well, it goes the other way as well. You're not giving them a choice by feeding them the, you know, McDonald's and the steaks and all of that stuff. You're absolutely not. You are always going to be dictating what they're eating. So you can give them healthy choices. Give them a plate of broccoli, peas, and carrots. Let them choose what they want. Right. Mm-hmm. That's how you do it. You don't let them choose the burger or the fries.
Mm-hmm. And you know, when you're talking about childhood obesity, the thing people like, we know obesity is linked with disease. But it's linked with so many. Like, think about it. It's arthritis, it's heart disease, it's high cholesterol, high blood pressure, cancers, right? Gastrointestinal diseases like Crohn's, colitis. It's not a small thing. Like, it's quite staggering. Mm-hmm. And yeah, because kids don't have a choice. The parents ultimately make the decisions. Always. We love them so much. This is a profound profession of love, to feed them a diet that is so steeped in hardcore evidence, knowing that it has immense benefits. Like, again, Matt was talking about the Adventist population studies, and the closer those people in the study got to plant-based, the better the benefits and the more normalized and regulated their weight. And so when we're sitting on amazing evidence like this, like arguably since the 70s, we've had some evidence rolling on a whole food plant-based diet as being incredibly beneficial. Why not? Why not offer your child that opportunity?
100%. Both of you said it perfectly. Thank you. And because both of you have been talking about this, I would just like, for in case somebody doesn't know, what is the difference between this whole food plant-based that you keep mentioning and just a regular plant-based vegan diet or eating habits?
Okay, well, veganism is something that's based on ethics, right? It's a ethical choice not to, or to contribute to the least amount of suffering possible. And so it really tells us what you're not eating, right? If someone's eating a vegan diet, they aren't eating meat, dairy, eggs, and honey. That's really it. It doesn't tell us what they are eating. They could be eating fruits, vegetables, whole grains, legumes, or they could be eating potato chips, pizza, and, you know, vegan pizzas and the Oreo.
Beyond Burgers, yeah.
Yeah, exactly. Beyond Burgers. Which, hey, once in a while is fine, but
I mean, yeah.
it doesn't tell us what they're eating as a whole. A whole foods plant-based diet is one that's centered on whole grains, fruits, vegetables, legumes, and nuts and seeds. Yeah, you might sprinkle in a little bit of, something else here and there as an occasional treat or indulgence, but for the most part, that's what you're consuming. And so that's what we're defining. We're really telling you what they are eating, not what they aren't eating in that case.
Yeah, because when we're talking about healthy eating habits, it's more the whole foods, plant-based diet than
Yeah.
the Beyond Burgers and the.
Yeah, but interestingly, when we look at the research on, like, say, I brought up some research on vegans. Whenever I mention research citing vegans, I'm talking about just vegans. I'm not talking about people who are really meticulous. Like, imagine if they were super meticulous about what they're eating, they'd probably be even healthier than they're.
Yeah.
So even then, we see that the average person with some maybe knowledge or information on these topics actually doing very well health wise, and of course with some extra information, they might be doing even better.
Thank you for pointing that out. Yeah, that's a good point to make, that it's just the vegan diet. It's not the specific plant-based.
Yeah, exactly.
So any right, like anybody who's worried about all the excess sodium and the processed and like what's even in a Beyond Burger, it's okay. Like I would still rather you have that than a beef burger, because if we had a true label on like what's in a beef burger and you're looking at the inflammatory component of heme iron and some of the estrogens and the different toxins and the saturated fat and the cholesterol, you might change your tune a little bit. And the fact that it's the class 2 carcinogen in the World Health Organization designation, right? So it's all it's don't eat a Beyond Burger every day, but it's okay to eat them.
Yeah, it's been directly compared to meat now. This year, we got a study called the Swap Meat Study, funny enough, and they had people eat either 2 or more servings of Beyond Meat products per day or 2 or more servings of regular meat per day. And then the Beyond Meat group ended up losing a little bit of weight compared to the other group and had better cholesterol levels at the end. Still not as good as they would have been if they were eating tofu and beans and all that, but it was certainly a better option.
Amazing. Thank you so much. So I think this will help probably be more for Jade. Do you have any advice? I don't know, Matt, you probably have some too. I'm not saying you wouldn't, on picky eaters and how to get your kids to eat a wide variety of healthy foods.
Yeah, totally. So lived experience, and I've done a lot of reading on it. And so, there's some arbitrary information that it kind of takes 3 weeks to really get your taste buds used to something. They've actually, I think, shown in adults that somebody who hates a food, if they eat it every day for 3 weeks, they actually can start to enjoy the taste to get used to it again. So don't give up on mushrooms, people. There's lots of people out there like hate mushrooms. Anyway, so the same goes for children. And so exposure is key, normalizing it, always making it available. I often tell people the first thing they should have out, say your kid is one of those ones that doesn't want to wait for supper like mine, always have a selection of veggies out, fruit, and let them pick away at it. No pressure, it's just there. But pay attention, like what are they eating? What are they trying? And then lots of positive reinforcement, right? When kids eat something that is healthy for them, woo, celebration. And in the meantime, work on still incorporating it in their diet, even if they're not having a lot. So I really am strongly against hiding things in food. That being said, you do want to make sure that they get a certain amount of nutrients. So as you're trying to encourage them to try that kale slaw or the steamed spinach in their pasta or whatever, blend the spinach in the smoothie. You can find the recipe for green monster smoothies, or green monster muffins, which have spinach blended right in. Make a marinara sauce with a bunch of roasted veggies or sauteed veggies, all kind of blended in, sure. But exposure, exposure, exposure. Really emphasize to adults around them to zip it and put on their poker face if they don't like something, because monkey see, monkey do. I'm telling you, kids pick up on that, right? So it's just about positive reinforcement, continued exposure, starting them early, and never putting a label on your kid. Oh, they don't eat broccoli. Don't ever do that. They hear you say it, they see you say it, and also you give up on trying it again with them.
Love that.
What do you think, Matt?
I mean, I don't have too much to add there. I mean, I know that I'll just take I'll take some information from Dr. Jackie Bussey, actually. She's a pediatrician, and I've seen her speak a couple times, and she's got some really good information. But one of the big things is repetitions. It can take 10 plus times for a child to actually accept a new food. So obviously don't give up, keep trying. Another big one is to offer choice. So don't just make them, say like you're eating your broccoli today. No, give them some broccoli, give them some cauliflower, give them some whatever other veggies you want, and give maybe 2 or 3 different options and let them pick. And maybe they'll choose one and maybe they'll like it. And that's great. It's more veggies for them. And then, of course, trying it again and again, and they might branch out eventually. And a big one that she mentions is getting kids involved with cooking. So get them involved in the kitchen, and they're just more excited to eat food that they've been involved in producing. And so that can be another way to, get them, help organize, certain veggies while you're chopping them up or something, and just making sure that they're involved in the process one way or another. So that would kind of be all I really have to add there.
And one further thing to add is that when our taste buds are saturated by processed food that is designed to really entice us and hit that salty and sweet and fat all at once, it totally desensitizes our taste buds, and our brain doesn't respond as well when we eat naturally sweetened foods, right? For example, so if say your kid isn't really keen on fruit, well, what is it that's also in their diet that may be taking away from them being able to enjoy the sweetness? So while you're trying to sort out a picky eater and you're wanting to expose them to more natural foods, don't just give in and give them all the processed stuff that they love. Try and find whole foods that they like in order to almost cleanse their palate, right? And this helps them to really hone in those taste buds that enjoy, like, oh wow, like this peach is really sweet, and oh wow, this carrot is also sweet and crispy, right? So that's so important.
Awesome. So you guys are amazing. Yeah, no, I think you both pretty much said exactly what I was thinking too, and what I personally as a mom has also found worked. So that's amazing. Well, thank you so much. And what we will do is, if there's anybody who would like to ask any questions, now it will open up the floor. We'll for the next 5 minutes or so and see if there's any questions. But is there anything else you two are very interested in wanting to just share or talk about? Because I think you pretty much covered everything I was hoping to discuss.
I mean, while we're waiting for people to throw questions in, I could just talk about growth for a second.
Oh, right. I wanted to
Yes.
ask you that. Sorry.
Yeah, that's a big one. So there are a lot of people that claim that plant-based kids end up growing slower, they don't grow as tall. And there's one paper that came out, I think, a couple of years ago, showing that by age, I think it was 3 or something, that plant-based kids were a little bit, I don't know if they're vegetarian or vegan or whatever, but a little bit shorter than their meat-eating counterparts. And that might be true. But by the time they reach, I think it's 10 years old, or especially adulthood, they're actually about the same height. They end up, so what happens is the plant-based kids actually might grow at a slower rate, but reach the same peak. And that's actually a good thing. That is more natural. Our growth rates have just gotten faster and faster over the past, several decades. And that has a lot to do with the diet, environment, and everything that's going on now. So, and rapid early growth is associated with higher risk of obesity, I believe, certain types of diabetes, and other health concerns as well. So we don't want that. So it ends up actually protecting them in the long haul. So I just don't want anyone to freak out if they ever hear that plant-based kids aren't growing as big or whatever, because it's not true. They end up growing bigger. And actually, by adulthood, or by 10 years, again, I can't remember the exact stat there, the plant-based kids were taller by a couple inches than the meat eaters. It just took them longer to get there.
And I guess genetics also plays a very big
yeah, for sure. That's why they're looking at a whole bunch of people, and right, so to try to tease out any genetic influence.
Perfect. Yeah, amazing. Well, thank you so much, both of you. It looks like we were pretty good. And with regards to reaching both of you, we do have links on our website to your social medias, your Facebook and your Instagram, if people want to follow you. But did you want to do kind of a quick shout out or anything?
Yeah, sure. My Instagram is probably the main source for myself. Is at Dr. Matthew Nagra, at dr.matthewnagra. I'm also on Twitter and Facebook, same name, but maybe a little less active there. I have a website, drmatthewnagra.com, where I post occasionally. I'm not super good at it, but occasionally some recipes or longer articles. And of course, my email is also on my social media and on the website if you need to reach me for anything. So that's kind of all my information.
So although my social media isn't as stellar as Matt's, I'm still on there. And, Dr. Jade Dittaro, you can find me on Instagram and Facebook. Just a caveat to it is I want people to understand that just because we promote the science of this doesn't mean that we also don't think about the animals and the environment. And so a lot of people get concerned that plant-based physicians can have an inherent bias because if we're vegan or animal activists. But at this point in the world, we have realized that there is a diet that is not only amazing for human health, but also helps us save the, what is it, like 80 billion land animals that are slaughtered every year for food. And it helps the environment. And I would highly recommend to anybody who is having some doubts about this, who's an environmentalist, who really wants to think about the impact of animal agriculture. If you haven't mentioned it already today, it's We Are the Weather, Jonathan Safran Foer. It's like the best book. It's if you, you know, for all those parents who really love their children and are just thinking about their future and the future of planetary health, please read this or listen to the audiobook. So just, you know, when you see our social media, know that we're humans coming at it from all angles. Sure, we'll give you the science, we'll give you the medical aspect, but we are also very passionate about animals and the planet.
Perfect. Well,
Yep.
great. Well, thank you so much, both of you, again, for coming and talking to us and sharing all your knowledge. I really loved this chat. And yeah, and thank you.
Thanks for having us.
Yeah, so happy to be here.
Yay.
Thank you.
Well, have a good night.
You too.
Take care.